best ways to eat chia seeds for your digestive system, arteries, blood circulation, insulin resistance, and thyroid. Yes, chia seeds are a superfood, but even superfoods have weaknesses. Don't add chia seeds to your diet unless you see this video till the end. From interacting with medications to causing digestive problems, these tiny seeds come with their own set of problems. Let's find out if chia seeds can really fix your health problems and what mistakes do you need to avoid while using them. So let's dive in. The effect of chia seeds on diabetes. If you have diabetes and are thinking about adding chia seeds to your diet, it's important to consider their high fiber content and how they will affect your blood sugar levels. The high fiber in chia seeds will slow down your carbohydrate absorption and prevent the sudden spikes in your blood sugar after meals. However, this can mean trouble if you are taking diabetes medication. Your diabetes medication is designed to work with the normal rise and fall of your blood sugar levels throughout the day. When you add chia seeds to your meals, this fiber can change these patterns by slowing down sugar absorption. This can reduce your blood sugar levels lower than you expect, which can be very risky for a person with diabetes. To manage this, you'll need to keep a close eye on your blood sugar. Any reduction in blood sugar naturally may require you to alter or even reduce your medications. Everyone's body reacts differently to chia seeds, especially if you have diabetes. While some people might not see a big change in their blood sugar levels, others might see significant benefits. You may have to balance your chia seed intake with your blood sugar levels. And medications. For the best benefits, start chia seeds in small amounts and increase slowly while continuously monitoring your blood sugars. It is best to do this in consultation with your doctor and nutritionist. Now, before we move on, please subscribe to the channel because that will give me the motivation to bring more well-researched health information for you every week. Number 2. The effect of chia seeds on people with blood circulation problems. Doctors often use the D-dimer and other blood tests to assess the risk of clotting disorders. Elevated D-dimer levels may indicate an increased risk of blood clots. Chia seeds are rich in omega-3 fatty acids, which are natural blood thinners. However, if you're already on blood thinning medications, then chia seeds can increase the effects of your blood thinning medications further. This increases the risk of bleeding, making it really important for people on such medications to be cautious. If you still decide to add chia seeds to your diet, start in small amounts and observe the effects. You may need to alter or reduce your dose of medication on it after a while. If you fall in this category of patients, don't try this alone. It's best to consult a doctor and keep watch on how your body reacts to chia seeds. Besides people on blood thinning medications, another category of people at risk of blood thinning effects of chia seeds are people who have undergone recent major surgeries and still have stitches or still require recovery from the wounds of surgery. Taking chia seeds in large amounts can increase the risk of bleeding for them as well. Number 3. The effect of chia seeds on digestive problems. Chia seeds contain roughly 35% fiber by weight, and that's a lot of fiber, especially if you're not used to it. The high fiber content in chia seeds can lead to bloating, gas, cramping, or even constipation, especially if consumed in large amounts. People with sensitive digestive systems should be mindful of their chia seed intake. To avoid digestive issues with chia seeds, start small and increase slowly over the next few weeks. It is also recommended to soak chia seeds in water for a minimum of 30 minutes, though soaking overnight is best before use. Number 4. Can chia seeds cause allergies? While uncommon, some people may experience allergic reactions to chia seeds. These reactions can range from mild skin rashes to more severe symptoms like difficulty breathing. If you are one of these, then it's best to avoid chia seeds altogether. Number 5. People with swallowing problems. One of the unique properties of chia seeds is their ability to absorb a lot of liquid. Chia seeds can swell up to 10 to 12 times their original size. This is because of the soluble fiber in the seeds, which form a gel-like substance when soaked. Swallowing difficulties are also known as dysphagia, and they are not uncommon. According to some studies, dysphagia affects about 1 in 25 adults annually in the United States. If you have any such condition and still want to include chia seeds in your diet, do it safely. Pre-soak the chia seeds in plenty of liquid like water or milk overnight until they have fully expanded before consuming them. This pre-soaking can make them easier and safer to swallow. However, even with pre-soaking, if you have severe swallowing issues, it's best to avoid chia seeds altogether. Number 6. Can pregnant and breastfeeding women eat chia seeds? Chia seeds are known for their rich nutrient content. They are an excellent source of omega-3 fatty acids essential for fetal brain development. They also provide fiber, protein, calcium, magnesium, and phosphorus among other nutrients. These components are beneficial for both the mother and the developing baby. However, you must look out for possible allergic reactions and stomach disorders. Every pregnancy is unique and dietary needs can vary greatly. If you still want to add chia seeds to your meals, it's best to introduce chia seeds in small amounts into the diet and observe how your body reacts. Do remember to pre-soak them in water for at least 30 minutes before use. Soaking them overnight is best. They can be added to smoothies, yogurt, oatmeal, or baked goods for an extra nutritional boost. Though chia seeds can be beneficial, remember to consume them in moderation. This is extremely important during pregnancy and breastfeeding when dietary balance is crucial. Finally, while chia is considered safe, it is best to consult your doctor or nutritionist before introducing any dietary changes like adding chia seeds during pregnancy or breastfeeding. Number 7. Is chia good for people on hypothyroid medications? The fiber in chia seeds can bind to thyroid medication and reduce their absorption and effectiveness. This reduced absorption could lead to an increase in hypothyroid symptoms. To minimize the interaction with food, doctors generally advise to take thyroid medication early in the morning, at least an hour before breakfast. For example, if you take your thyroid medication in the morning, it might be better to consume high fiber chia seeds later in the day. Number 8. Can people with acid reflux or SIBO eat chia seeds? GERD, which stands for gastroesophageal reflux disease, is a more serious and persistent form of acid reflux where the stomach acid flows back into the esophagus and mouth. Symptoms of GERD include heartburn, a burning feeling in the chest, regurgitation of food or liquid, and difficulty swallowing. For some people, chia seeds can increase the acid reflux symptoms. Additionally, the lectins in chia seeds can interfere with the gut lining repair, which is a concern for individuals with small intestinal bacterial overgrowth or SIBO. If you still want to add chia seeds to your diet, it's best to introduce chia seeds in small amounts into the diet and observe how your body reacts. As before, pre-soak them in water for at least 30 minutes before use. Of course, soaking them overnight is best. I hope these suggestions will help you safely add chia seeds into your diet. However, do remember that these are general guidelines and not medical advice. Everyone's health situation is different and unique, and what works for one person may not work for another. Therefore, it's always wise to consult a doctor or nutritionist, especially if you have any of these health problems, before making changes to your diet, as they can provide personalized advice based on your health history and current medications that you're taking. If you like this video, check out my other videos so you can keep getting those nutritional boosts, and I will see you in the next video. Thank you.